Hello, welcome to Dental Notes and Mnemonics. Today we'll cover a fundamental topic in restorative and prosthetic dentistry, shade selection. Achieving an accurate shade match is key to creating aesthetically pleasing restorations. Our discussion will include the basics of tooth color science, methods of shade selection, and commonly used shade guide. So let's begin. Before going into the methods, we need to understand the three components of tooth color. First of all, the hue. This refers to the basic color of the tooth, such as yellow, brown, or gray. Most natural teeth fall into these categories only. Second is value. It is to describe the brightness or lightness of a tooth. A high value means a brighter tooth, while a low value indicates a darker one. Third component is chroma. This represents the intensity or saturation of a color. For example, how vivid the yellow or gray color appears. These all components work together to create an overall appearance of a tooth. Understanding them helps in precise shade matching. So moving ahead, we'll discuss about the methods of shade selection. Visual method is the most widely used approach and relies on comparing the tooth to a standardized shade guide. While visual methods are simple and cost effective, this method is subjective and influenced by external factors including lighting and the clinician's visual perception. Now coming to the second method, instrumental method. This method uses advanced tool to measure tooth color. Example in this method is spectrophotometer, which uses a wavelength. When it is reflected from the teeth, it gives a precise data about the color or the shade selection for a particular teeth. Colorimeters measure color in a standardized system like lab. High resolution cameras capture and analyze tooth color for consistent result. This method is objective and highly accurate but requires investment in equipment, regular calibration and training as well. The hybrid method combines the simplicity of visual method with the accuracy of instrumental tools. We always start with a visual shade guide selection using a shade guide and confirm and refine the choices using a spectrophotometer or a similar device. This approach strikes a balance between the practicality and precision, ensuring optimal results. However, it can be time intensive and resource dependent. Now we'll discuss the factors affecting the shade selection, and we will divide them into three crucial aspects. First is lighting condition, tooth and surrounding factors, and third is viewing techniques. First table highlights the importance of proper lighting during the shade selection. Always aim for the natural daylight or use a color corrected light source around 5500 Kelvin. However, artificial lights can alter the perceived shade, so avoid this and position yourself near a window or use a daylight simulators. Also ensure the light source is uniform and evenly distributed over the tooth and shade guide to prevent mismatched area. Avoid mixing lighting as it can create a visual confusion. Moving to the second table, it's vital to prepare tooth and surroundings before the shade selection. A hydrated tooth shows its true shade, but a dry tooth will appear lighter than actually it is. So always rinse and hydrate the tooth before proceeding. Tooth cleanliness is another important factor. Stains, plaque and debris can skew the results. So ensure that tooth is clean using a non-abrasive cleaner. Finally, control the surrounding colors. Bright clothing or bold lipsticks can reflect onto tooth, altering the perception. To neutralize this, drape the patient with a gray bib or use a neutral colored background. The last table emphasizes the proper techniques and tools for shade selection. Limit your viewing to 5 to 7 seconds per observation, as prolonged viewing can cause visual fatigue and desensitize your color receptors. To refresh your vision, glance at a neutral gray surface between the observations. Observe the tooth and shade guide at the correct angle, that is perpendicularly and at the eye level. This ensures consistent lighting and reduce the perspective errors in shade selection also. When available, incorporate digital shade matching tools or spectrophotometers. These devices provide objective shade references, but remember to calibrate them regularly for accuracy. Let's now review the most commonly used shade guides in the dentistry. In Vita Classical Shade Guide, it is one of the oldest and commonly used shade guides, and it remains a staple in dental practices worldwide. It is divided into 4 groups based on hue A, B, C, and D, and each group contains multiple shades, giving a total of 16 options to match the natural dentition. The guide is primarily arranged by the hue, making it intuitive for quick visual comparison. The guide is Vita 3D Master Shade Guide. It was introduced to overcome the limitations of Vita Classical system, which were the less precision for advanced aesthetic cases, and also it does not account for brightness as comprehensively as modern grids. On the basis of value, which determines the brightness of the tooth. Chroma is to refine the color intensity, and hue further adjusts the basic colors. It contains 26 shades which provide a broader range of matching options. Custom shade guides are designed for specific materials or patient needs. It is used in complex cases or for customized restorations. So let's discuss that how to use a shade guide correctly. The step 1 includes match from the dentine. As dentine has the most significant impact on the color of the tooth, so it is essential to prioritize it when choosing a shade. Enamel is more often translucent and can reflect the dentine's hue, but the dentine's color will be core match you need to focus on. The shade tab should be positioned parallel to the tooth being matched. It should not be behind the teeth as it will appear darker, or in front as it will appear lighter in shade. Lightness, chroma and hue is followed first during the selection of the tab. Then the tab which is closest or an appropriate combination is chosen. If there is no perfect match, the lighter shade is selected, to which the extrinsic correction can be done. Sequence for shade selection is: start with selecting the appropriate lightness or value, then match the chroma and fine tune the hue. If no perfect match exists, choose a lighter shade and make extrinsic corrections. Your eye should be at the level with the patient's tooth. Maintain a perpendicular line of vision to the tooth surface. Ensure the viewing angle is at least 2 degrees. Limit each matching trial to 5 seconds. Take pauses by observing a blue card between the trials to refresh the visual perception. Finally, always double check the selected shade by comparing it with the adjacent tooth. This is essential for achieving a restoration that looks natural and does not stand out. So let's discuss the common mistakes you can do while shade selection and procedures or measures to avoid them. First of all, ignoring the proper lighting condition. Always choose a shade under natural light or 5500 Kelvin artificial light to ensure accurate color matching. Focusing on enamel rather than the dentine can also a source of mistake in shade selection. Start by assessing and selecting the dentine color first, as it provides the base color. Enamel is translucent, so its color is influenced by the underlying dentine. Third mistake you can do is not accounting for patients' natural tooth variations. Pay close attention to natural variations including yellowing or gray tones, and match the value and chroma accordingly to replicate the natural appearance. Number 4, a mistake you can commit is overlooking the value. First, match the value, as it plays the most crucial role in determining how the restoration blends with the natural tooth. Only after selecting the value, move on to the hue and chroma. Too long to make a comparison leads to visual fatigue, which can distort perception of the color. So limit your shade selection to about 5 to 7 seconds. If uncertain, look away or blink to reset your vision before proceeding with the final judgment. Relying only on one shade guides to choose a color which may not cover the entire range of possible tooth shades. Use at least two different shade guides to ensure a broader range of shades, especially when dealing with a unique or hard to match tooth color. Not comparing the selected shade to the adjacent teeth, which can lead to noticeable mismatch. Always double check the shade choice with the adjacent teeth to ensure that restoration blends seamlessly with the rest of the dentition. Also take account the patient's age and habits while shade selection, because it might affect the shade of their teeth. For example, older teeth may appear to have darker hues, so adjust the value and chroma accordingly. Also take your time comparing the tabs and use of all the three components to make a thorough comparison. Small adjustments can lead to much more better result. Bleached teeth are lighter with altered hues, often requiring special attention during shade selection. Use bleached shade guide like Vita bleach shade guide for the lighter options. Match shades under natural daylight to avoid color distortion, and select a shade slightly lighter than the untreated teeth for better uniformity. Wait at least 2 weeks post bleaching for color to stabilize before any restorative work can be done. Thank you for watching. If you found this video helpful, don't forget to like, share or subscribe to stay updated with more content. See you in the next video. Till then, bye bye. Take care. Have a nice day.